Thanks for joining me. I want to talk briefly about something that is very near and dear to my heart, and this is embracing an anti-pathologizing or non-pathologizing lens. This phenomenon of pathology is really relevant in the discourse of professional helping practices such as psychology, sociology, psychiatry, and psychotherapy, which together attempt to explain and treat what ails us. This rise of experts arguably reflects a movement towards a single discourse at the expense of others, a meta-narrative, if you will, to understand the human condition. Unfortunately, acceptance of such pathologizing discourses may result in limits to therapeutic gains and further alienate, marginalize, discriminate, and stigmatize associated with mental health and addictions. So one of the principal ideas of good therapy then is that we are promoting what it should be, a practice that is non-pathologizing. That is, difficulties faced by clients should not be seen as intrinsic, inescapable diseases, nor should treatment focus on healing an issue in such a way. There are many reasons why a departure from pathologizing therapy is beneficial, both for the client and for the mental health professional, not to mention the field at large. However, the real challenge comes when practitioners, in particular new practitioners, find themselves located within health authorities, clinics, hospitals, and the like, where there is an expectation that they will provide a diagnosis or use the language of the charting when they talk about particular clients. This is often a frustrating experience for those who are new to the helping professions. Another bad consequence of this pathology is the systemic focus on human beings as objects rather than as subjects. And there's many research initiatives afloat that suggest that problem-based models focused on pathology are challenging as they ignore significant subjective information when prescribing treatment protocols. I should note here that while it is important to embrace a non-pathologizing stance, for some individuals, a diagnosis and use of the DSM-5 is indeed justified. Here, I suggest we look at the outliers. For example, the people who struggle with significant depression, years of dealing with symptoms of schizophrenia and addiction or chronic suicidality. These are accurate diagnoses when both the language is matched appropriately and treatment is strongly advised. And I back that from my years, being on the front lines in various platforms and realizing that while we can definitely suggest non-pathologizing, we have to acknowledge when these outliers require that treatment protocol attached to that diagnosis. However, is the other cases where a particular language is used to describe someone without acknowledging the wholeness of the person, such as this person is a hoarder or they're depressive, a schizophrenic. That's really not only unethical, but can be extremely stigmatizing to some. So in what ways can you put into practice a non or anti-pathologizing stance? I try to remember things such as a noun versus a verb. So there is more to a person than just a diagnosis. This person is not a depressive. They are a person who deals with depression. They are not a schizophrenic. They are a person who deals with schizophrenia. The languaging here is very important, not only in terms of how we talk about this individual in case conferences, but how we chart, because these things will be on files for many years to come. So that leads me to number 2, treating the person and not the chart. If you have previous charting on a client, it's important to take time to review the file. Many clients will come with a previous diagnosis. So I will often ask, if it feels safe to do so, what is their previous medical history? Are they aware of any previous working diagnoses? And if they are, do they feel that they were accurate? And number 3, avoiding the tendency to use the word normal. Unfortunately, this word is located everywhere in the helping professions. What does that word mean anyway? What society holds this to be the ideal? Instead, I ask clients, how do you want to be on any given day, or what level of functioning throughout the day would you be okay with? In this way, you step away from what society dictates and locate things within the client's place of comfort.